going to come to the opposition spokespersons. Danny Chambers.
Thank you, Chair, for allowing me to speak. As a veterinary surgeon, I come from a profession with a suicide rate of 4 times the national average. So, like many people in this room, I've experienced the pain of losing friends and colleagues to suicide. And it led me to becoming a trustee of a mental health charity for several years, and I'm honoured to be the spokesperson on mental health for the Liberal Democrats. While we are undoubtedly focused on NHS clinical services in this debate, we often underestimate the profound impact that non-medical issues such as living in poverty, financial worries, debt and insecure housing can have on mental health, and how they can hinder recovery from a mental health crisis. And so I'm incredibly proud of a project that I visited just last week in my constituency in Winchester, run by Melbury Lodge Mental Health Hospital and the Citizens' Advice in Winchester. Now, this project provides one-to-one advice and support to inpatients on matters relating to living in the community, from relationship and financial advice to management of debt and benefits and housing problems, because people find that they end up admitted to a mental health unit, and their post and correspondence relating to their benefits and mortgages and other bills are all going to their home, and if there's no one else living there, they won't be receiving any of this. And then when they're discharged, they get out and find that there's a problem with their benefits, or they've received a huge bill that they weren't expecting. So amazingly, this Melbury Lodge and Citizens' Advice team have demonstrated that for every £1 spent on this project, the NHS system avoids spending, on average, £14.06, which is a huge return on investment. As we extrapolate out, the research shows that having the Citizens' Advice Service on site means that Melbury Lodge have avoided spending nearly £250,000. Now, this cost avoidance is achieved through shorter inpatient stays, fewer readmissions, reduced medication, and better engagement in community services. Now, this is a staggering amount of money that can now be spent directly on clinical care. So I'd urge the government to look at the results of this initiative with a view to rolling this out in other parts of the country, because it's good for patients, it's good for NHS staff, and it's good for the taxpayer. And I'm really excited that this project has been shortlisted for an NHS Parliamentary Award next week, and I'm looking forward to supporting them in person. But we need to also acknowledge the impact the lack of mental health care has on other public services. So when I go out with the police in Winchester, they tell me they spend between 40% and 50% of their time dealing with mental health issues in some capacity. And the Honourable Member for Hastings mentioned the cost of people in a mental health crisis who are often already on a mental health waiting list arriving at A&E. And certainly one of the biggest issues brought up to me by parents in Winchester is the huge delay in children who are waiting for diagnoses of ADHD and autism. So the Honourable Member for Ashford discussed already that the DASA report acknowledged that 20% of the NHS disease burden is mental health issues. And, oh, yeah, sure, go ahead.
Oh, sorry. Thank you, Mr. Dowd. Would the Honourable Member agree with me that too often people are mistaking neurodiversity, which is something that we should be celebrating, with severe mental illness, which is something that we need to be supporting and managing, and poor mental health, which is a day-to-day thing that can often be caused by circumstances?
That's a really important point, a very good point. And we also need to acknowledge that people with certain issues like neurodiversity or undiagnosed ADHD, autism, that don't get the support they need are then more likely to get mental health issues because they're not getting the support they need. So it's a bit of a chicken and egg situation. But just to finally finish up, I was just saying that the NHS budget is only 10% is for mental health, and yet it's 20% of the disease burden. And yet, the obvious question people ask is, well, how do we afford this? Well, when you look at the pressure on the police, on A&E, on the education system, the question I'd ask is, how can we afford not to treat mental health properly? Thank you.
Thank you. Opposition spokesperson.